I am Divyah from Group 25. Today, I will be talking about assisting a patient when it comes to sequential compression hosiery. Let's get started with the background about what is this about and what do you use this for. So sequential compression device, or we can shorten it as SCD. So SCD is a method when it comes to improving blood flow of legs. It's used mostly to improve blood flow of legs. So it is like a sleeve that is wrapped around your legs, and it also inflates with air at time. So like one at a time it inflates with air. So this kind of like imitates the action of walking. So this helps prevent any blood clots. Since it actually improves blood flow, it prevents blood clot. So now that we know generally how does it look like and what is it, like an overall description of what is it, why do we need it? Let's start with DVT, or deep vein thrombosis. So deep vein thrombosis occurs when blood clot develop in one of the deep veins in our body. So without a treatment, DVT, deep vein thrombosis, can cause potentially life-threatening conditions such as pulmonary embolism, which is PE. PE. PE occurs when a blood clot breaks off from the vein and it travels to the lungs. So these are all life-threatening issues that is caused by blood clots, and it is actually one of the most common post-operative complication ever. Hence, now that we've seen the numbers that more than 50% of our patients obtain this post-operative complication, we need to know the symptoms too to identify it. So how does DVT look like? I've attached a picture here. So the main symptoms are red areas on leg, swelling on one area or one whole leg, and then there's pain and tenderness, and also an area of the feet will feel warmer to touch. Next, let's start with how does this device look like up close and how do we operate it. So this device, as I said, it has sleeves, and the sleeves have Velcro. So it is easy for proper fastening and secure fastening. It doesn't come out properly. And of course, the size must be proper. When it comes to choosing for a certain patient, the size must be proper. Next, there are tubes that you will attach to the main motor. Image for visual purposes. So overall, this device, it has a sleeve, tubes, and also a main pump. Next, we're going to go to the practical part of how do you assist when it comes to sequential compression hosiery. Before we start the procedure when it comes to using the device and all that, always carry out initial procedure action. What do they mean by that? Dangling and also assisted ambulation should be done to patient, because sometime after surgery, a patient is permitted to sit up and have their legs over the bed when it comes to first ambulation, as in first walking steps after a certain surgery. So this is usually short, and this is an important part of post-operative care because it stimulates the circulation.
For demonstration purposes, I will be using this item to demonstrate the device. Explain to patient about what you are going to do. Measure the leg of patient to identify the proper size of hosiery. Lift the patient's leg and slide the hose under it. Wrap the sleeve smoothly around the leg. Beginning from ankle to thigh, fasten the Velcro securely. Check the fit by inserting 2 fingers. Wrap the other leg in the same manner. Attach plastic tubing on each leg by lining up the arrows and plug the controller and turn on. For visual purposes, this is how it looked like. Remain in the room for one complete cycle, 60 to 90 seconds, to ensure that the patient tolerates the procedure. This is how the pump should be placed for visual purposes.